So, good day. My name is KARL from BSN M4A. So, for today, I'll be performing a hot compress on the patient. So, first, I'm going to verify the client's identity using 3 identifiers. So, sir, may I know your name? Sir, are you awake? May I know your name, sir? Okay. May I know your date of birth?
June 22, 2007.
May I check your wristband? Okay. After checking the patient's wristband, I will now verify the type of moist application that we'll be using on the patient, as well as the location, duration, and the temperature of the moist application. After that, I'm going to review the patient's medical history, as well as the if there are any contraindications for the patient. After that, I will assess the client's skin, and if there are any pain and sensation of the patient's wound. So, sir, may I check your skin?
Yeah.
Is it painful when I touch?
No.
Not really.
Yeah.
So, from the scale of 1 to 10, how would you rate it?
3.
3? Okay. So, the patient's pain is 3 over 10, which is a little bit less than a very painful, but it's still painful for the patient. Okay. So, after that, I'm going to inspect if there are any wounds. So, since there's no any wounds, I will now assess the client and family awareness about the procedure and understanding. So, assuming that I've already assessed the client, family, and understanding of the procedure, I will now assess the client's vital signs and mobility. So, sir, I'm going to use or need to use your other hand for checking your vital signs. Okay. You may have your hand. Okay. So, it seems that the client blood pressure is 120 over 80, which is normal. Next, we're going to check the patient's oxygen saturation and the temperature of the patient. So, sir. Okay. So, the patient's oxygen saturation is 97, which is normal, and the RR of the patient, which is respiratory, is 16 over 20, which is normal as well. After that, checking the vital signs, I'm going to assemble the materials needed. So we're going to need a basin, a hot or warm water, as well as a towel for the procedure. So after that, after assembling, I'm going to explain the patient the procedure. So, and ask for their consent. So this procedure is a warm compress, sir, that increases the blood flow of your arms, and then it helps speed up the healing process. So, and reduces the pain as well. May I have your consent, sir?
Yeah.
Okay. After that, I'm going to provide privacy for the patient at all times by closing the curtains. Okay. So after closing the curtains, I will position the client in bed and keep the affected area aligned, as well as expose only the area that is needed to be assessed. So, since assuming that we have the patient, I'm going to check the patient and align the wound properly. So, here, after positioning the patient in a comfortable position, I will now place a towel under the patient's pad or arms and perform hand hygiene before doing all of that things. So, I'm going to perform hand hygiene and put on gloves. And after doing that, I'm going to place a waterproof pad here on the patient's arm. Next, after that, I'm going to apply the heat compress to the patient, and sir, you may feel a little bit warm on this area, so expect that the blood flow will increase. Okay. So after that, I'm going to remove or remoisten the hot compress and then apply it as well again. Next, after that, if there are any problem that occurred, I'm going to stop it immediately and then I will inspect the body part or the wound condition for evidence of effectiveness. So there is no more swelling on the patient's arm, and it's a little bit warm due to the hot compress. After that, I'm going to ask the patient to describe the level of comfort as well as the burning sensation following the treatment. So, sir, are you comfortable? Are you feeling comfortable in your hand now?
Yeah.
From the scale of 1 to 10, what's your pain level, sir?
1.
Okay, so from 3, it's now 1. As with according to the pain level of the patient, so it decreased, which is a good findings. After that, I'm going to identify any expected outcomes of the patient. So the healing process should be faster now because of the hot compress. And now I'm going to identify, document all the expected or outcomes that I've assessed on the patient. And now I'm going to inform the physician and perform hand hygiene again. That's all. Thank you.